Imagine this moment. You reach the peak of pleasure. Your heart races, your body trembles. Everything feels normal, but when it's over, you look down, and there's nothing. No semen, just silence. You feel confused. What just happened? You start to wonder if something's wrong with you, if you're still the same man you've always been. That quiet panic you feel? You're not alone. This is called dry ejaculation, and it happens far more often than most men talk about, especially after 60. We'll talk about blood pressure, joints, or diet, but when it comes to our sexual health, silence takes over. And that silence hurts more than the symptom itself. Many men start to avoid intimacy, afraid their partner will notice. They feel embarrassed, thinking it means their masculinity is fading. But here's the truth. A dry orgasm doesn't mean you've lost your desire, your strength, or your manhood. It's simply your body sending you a message. And that message often has an explanation and a solution. To understand it, you need to know this. Orgasm and ejaculation are two separate things. The orgasm is the feeling, that wave of pleasure controlled by your brain and nerves. Ejaculation is the physical release, when muscles and glands work together to push semen out. In a dry orgasm, you still feel the pleasure, but the semen goes missing because something in that process has changed. There are three main reasons. Number 1, retrograde ejaculation, when semen flows backward into the bladder instead of out. This can happen after prostate surgery or from certain medications. Number 2, blockages, when ducts are scarred or blocked from past infections or surgeries. Number 3, low testosterone or nerve issues, which can reduce semen production or weaken the muscles involved. Most of the time it's harmless, but if it appears suddenly, causes pain, or includes blood, see a doctor right away. These can be signs of something more serious. Here's the good news. Dry ejaculation is treatable. A simple urine test, ultrasound, or hormone check can identify the cause. Treatments range from adjusting medication, doing minor procedures to clear blockages, or restoring hormone balance with medical guidance. And don't forget, your lifestyle matters. Controlling diabetes or blood pressure, staying active, eating healthy, and sleeping well all protect your sexual health. But the biggest step? Talk about it. With your doctor, with your partner. Silence creates distance. Conversation builds connection. Your desire, pleasure, and confidence don't have an expiration date. Dry ejaculation doesn't define your manhood. Understanding it does. So if this message speaks to you, take action. Break the silence. Reclaim your confidence. Your body still works. Your passion still lives. And your intimate life is far from over.